And welcome to Picks and Politics, everybody. I am Dan Manarino, and Mayor Zohran Mamdani making this administration his own, really, creating this new department in city government, the Office of Community Safety. The mayor saying this really reaffirms his commitment to New Yorkers left behind, like those impacted by gun violence, mental health struggles, or victims of hate crimes. And leading the charge, a new deputy mayor taking the position, Renita Francois. Her background rooted in community programs and public service, and today she is going on the record. Deputy Mayor Francois, great to have you first here on Picks and Politics in person, your first time here, and congratulations on the appointment.
Thank you, Dan.
Let's talk about this, right? This was a big campaign promise by the mayor. He had talked about this often during the campaign trail, that he wanted to really create this agency. And this is a scaled down version, a department within the mayor's office. Can you talk about the scaled down approach and what you hope it to grow towards?
Yeah, so I will start off by saying our North Star, of course, is still the Department of Community Safety, and the mayor is very much committed to that. We're starting off with an office because we want to be intentional about the development of the department, but we also want to start now. And so trying to stand up a new agency when there's a critical need for this work and these services now, and for us to support the offices that are underneath OCS to do the critical work that they're doing today, to really take a look at these programs and evaluate what is working effectively, where they might need support and bolstering and investment is really my priority and the mayor's priority coming in. And there's plenty of departments that we're currently familiar with, like the Department for Homeless Services, like OEM, the Office of Emergency Management, and even ACS that started off as offices and then grew to the departments that we know. So we're just following the same established process, but we are definitely still committed long-term to the Department of Community Safety. Yeah,
wondering if the scaled-down approach has to do anything at all, just kind of given the budget deficit and crisis the city is in right now. You're starting off with a budget around $260 million, and that was something that was allocated to this office that will not go away. But is the scaled-down approach because of the budget issue?
No, I think it's really, like I said before, about the intention and really following this process of understanding what we have. I know that there's a lot of interest from folks to see these sort of grand sweeping gestures around what we will do with the office, but there's so much incredible work being done that New Yorkers just aren't aware of and that many people are not aware of. And so we want to make sure that we are focused, laser focused on that programming, on that work that is already funded, and how we can figure out how to really maximize the success of that work before we just start jumping in and making, long-term decisions without doing our proper due diligence.
And so under the office, you'll do things that fall under mental health, domestic violence, gun violence, hate crimes. Can you talk about what you really hope to accomplish within the beginning stages? You said you want to hit the ground running. So what may a New Yorker see under those things?
Yeah, in the beginning phases, I think we really want to focus on infrastructure, building a really solid team who can actually execute on this work. I am, for one, committed to making a believer out of folks when it comes to what this department and office can do. I've seen firsthand through my work with the Mayor's Action Plan for Neighborhood Safety and the Office of Neighborhood Safety that exists today. And I know that work and the folks who do that incredible work, both on the city side and in the nonprofit community, are really just tremendous and really hardworking folks. And so I think lifting up that work for people is something that we, want to do, are very hopeful about doing, and I'm just looking forward to getting back in there with folks.
And the idea behind this office was that to help the burden of a police officer who shouldn't necessarily respond to every single call that comes to 911. So what is the collaboration that you'll have with the NYPD in working to ensure who responds to what call?
Yeah, that's definitely something I'm looking forward to working with our partners in law enforcement and all of the relevant stakeholders in the mental health advocacy community and the folks with expertise that already work for the city. I'm looking forward to us getting together and really thinking about how we match the appropriate response to the incidents that occur. I know that one thing we all understand is that the status quo is not working, and doing the same thing over and over and expecting a different response has a name. And so, we don't want to keep doing that here in the city, and so I'm committed to working with all of our stakeholders to figure out what the right approach to different circumstances would be.
So can you walk me through an instance about mental health, because that is what I hear from New Yorkers the most about, is that mental health is the problem on the subways, on the street, and it is also this cycle, which I'm sure you're well aware of with your past work as well, that people get taken off the street, they get some help, and then they end up back on the street. And then some of these calls are going to 911, and unfortunately people have lost their lives when a police officer may show up, whether it was wrong or right. How do you plan to work specifically on this issue?
Yeah, on this issue, I think for us, the goal is really disrupting the cycle that you described of folks going from, the streets to the hospital to jail, and then,
back to the street.
Back to the street or into an encounter with law enforcement. That's really what we want to avoid. And so I think that our partners over at Health and Hospitals and DOHMH, they're still, of course, the centerpiece of our mental health work. And at the community level, we look forward to partnering with them, to working to figure out how do we bring the resources of the Department of DOHMH and of HHC and all of the other relevant stakeholders, how we bring that work down into community for folks to access. It's really about accessibility. And so I know that the Department of Community Safety can really play a central role in helping other agencies understand how that accessibility should reach New Yorkers.
And I don't want to get too into the weeds. I know you're fresh on the job. But if someone were to encounter somebody in a mental health crisis and they call 911, is it where this office now steps in and says, well, we'll handle this one?
I think that's to be determined. That's one of the things that we have to decide. We have things as they exist today, the status quo, which is, co-response, be heard, regular 911, like all of those things exist today. And we need to take a look at them to really understand what should happen in those instances.
Right. It's all a new, fresh approach, and you're asking for patience. I want to ask about just kind of how you see this office overall playing out. It is something that the mayor can obviously start because it's under his purview, but it would need the city council or somebody to make it in a full-on city agency. And Lincoln Ressler has said that he wants it to become law, that this will be something that if Mayor Zohran Mamdani were to leave office, could stay. How do you see that playing out?
Yeah, I think that process will follow the process that it does. I think that the mayor is grateful for Councilmember Ressler's support. I know I appreciate the support, but we are looking forward to working with the various stakeholders to bring the department to life in the best and most sustainable way possible.
You want it to become law? That it has to exist.
We want the department to exist and exist beyond this administration, and so we're exploring the many avenues available to do that.
I want to talk about you for a second.
Yes.
You've been working and pushing these types of initiatives at the city level for nearly 2 decades. Your work speaks for itself. You have quite the resume, working in the de Blasio administration to reduce violence, specifically in public housing, right? So you're well versed in so many of these issues. Was this a job that was, for you, easy to say yes to?
I think it was never a chance that I would say no, because I understand just how critical this work is to folks who are in our most disenfranchised communities, who have often felt overlooked and estranged from their government. And I'm, proud to stand beside a mayor who has the empathy and the understanding, the knowledge, the foresight to know that we need a new way, that the old way hasn't been working, and we really want to connect the pieces of government that really lay our social fabric and the social safety network for folks in our communities throughout the city. And I'm just grateful to be a part of and still continuing on to do this work.
Looking forward to seeing where this goes. This is just one of, I hope, many conversations we'll have along the way. Deputy Mayor Renita Francois, great to have you here.
Thank you for having me.
Thank you.